All right, and thank you all so much for coming to our weekly COVID-19 meetup and check-in. I believe this is session number 6, and we're still going strong we have over 50 participants today, so thank you all for making the time to come and share your experiences with us today. We are recording this webinar and I will be posting it on Vimeo afterwards. And I will also include all of the links that we share in the chat box today to Vimeo as well. We'll also be sending out an evaluation afterwards. So please make sure to look at all of those things if you need it. Before we do get started though, we want to do 3 deep breaths as a way to kind of calm our monkey minds and take a little bit of time for ourselves. So if you're sitting at your computer, at your desk, wherever, if you can just make sure to sit up straight with your feet firmly on the ground or firmly on a surface. Put your spine up tall. Really try and open up your shoulders. Sometimes I don't realize, but my shoulders like to creep up and try and become earmuffs, and that puts a lot of tension in there. So try and relax those down, open up your collarbone and your shoulders, and let's do 3 deep breaths together. So inhale. Exhale. Inhale. Exhale. Inhale. And exhale. So some other things that you can do if you ever need another breather is you can always put your hands over your heart and kind of really press and put some pressure there. You can always do cactus arms, which I enjoy. That kind of helps me stretch out my back and my arms as well. Or even a simple sun salutation for those of you who enjoy yoga or want to get into yoga. So just some suggestions there. For today's agenda, we have a few things to discuss. One of them is preparing for regression. And by regression, I mean currently we're in phase 1 of reopening. And I truly do hope that it's just improvement from here on out and we can advance linearly through the plan. But we do have to prepare for maybe we get to phase 2 and then we have to move back to phase 1, or maybe here in phase 1, we might have to move back to shelter in place. And so moving from stage to stage and making those kinds of preparations might be important for us to think about and consider. So that's one thing that it would be good to discuss. Another thing is some economic development opportunities. I will be going over these on Friday as well at the website chat. But we wanted to mention some of them to you today because some of these opportunities have come up pretty suddenly and have sort of a quick turnaround. So we wanted to gauge some interest to see what you all think and see where we can go from there. And then we just have some general announcements. Some information that we wanted to share with you all. At any point in time, also feel free to, you can unmute yourself and talk, but you can also put stuff into the chat box and we will make sure to bring that to people's attention. So the first thing is talking about reopening guidelines, and we are currently in phase 1 of reopening Montana. And from what I last saw, I don't think there's a definite date for when phase 2 will start. So there's no set timeline. A couple of things that we've linked on this page, there are frequently asked questions that the governor's office has provided about phase 1. So there's the actual phase 1 document, And then there's a bunch of clarifications and addendums and further guidelines that are being actively updated by the governor's office with more information. So that's a really good thing to consult. And then I believe it was earlier this week or maybe even last week, Jenny had written something on Wired talking about phase 1 of reopening. And so it consisted of some really good questions to consider, and the questions are on this next slide in this PowerPoint. None of these documents explicitly mention libraries, but they have general guidelines and procedures that they would like all establishments to follow. And if your library is not able to meet these established rules or these guidelines, then it's something that you should consider about whether you should reopen or not. So let me drop these links into the chat box really quickly. Let's see. Here I'm adding the statement from Wired that Jenny had sent out about phase 1. And then I'm also adding the COVID facts about phase 1. And that's a document that I just sent. And that's something that you should definitely check back with every now and then, because they are updating that. And so here are some of the questions that were in those reopening guidelines. And hopefully you have looked through some of these things. And I believe, Jenny, are you?
Jenny has just joined, so I.
Okay, great. Jenny has entered the building.
Jenny has.
Yes. Hi, everybody.
And so, Jenny, we were just talking about phase 1 of the reopening and the FAQ document, providing some more clarification. And then we just got into these questions. So if you wanted to discuss a little bit more about reopening thoughts, that would be great.
Yeah, happy to. Can everybody hear me okay?
Yes.
So I know you guys have already talked about the fact that the reopening guidelines did not specifically mention libraries, and I'm not at all surprised by that. The governor never called for the closure of libraries, so it makes sense that he wouldn't address libraries reopening when he came up with this kind of plan. And as I've said before, I'm really grateful that he never called for the closing of libraries, because I really think that that would have sent the wrong message to Montanans about their ability to access library services. So that said, there's a lot of, I think, helpful guidance in the reopening plans that we can look to help us evaluate, really on a case-by-case basis, whether or not our libraries are ready to reopen to the public and in what manner we might reopen, what kinds of specific services we can put in place in order to keep our staff safe and to keep our patrons safe. And if we can't do that, then to make the decision to not reopen, at least for the time being. So one of the things that is called for in the plan is that employers have the ability to screen staff for symptoms of COVID-19, whether that's asking them if they feel well, if that's taking their temperature, something like that. So I think you need to ask yourself, do you have the ability to do that? And then were one of your patrons or one of your staff to become sick or to develop symptoms, take the necessary steps to close the library again. Notify your staff, keep them at home, probably keep them quarantined, notify any patrons who may have come in contact with other patrons or staff about a possible exposure as well. There's been a lot of discussion within these meetings and elsewhere about the use of personal protective equipment for employees, including asking staff to wear masks. I know many of you are thinking about installing plexiglass to limit exposure. So, a question again to ask yourselves, do you have the ability to put that kind of protection in place? one of the things that's really important for any kind of public building is to continue to maintain social distancing. And we're all familiar now with the tape that's down in different kinds of stores, moving furniture, perhaps removing some furniture so that furniture is not closely near to other furniture, public access computers, that kind of thing. Perhaps only opening certain areas of the library, not encouraging people to linger in certain areas. The guidance can be a little bit confusing when it comes to the number of people that are gathered together. Some people have asked about, does limiting the number of people in a library mean that, or the number of people gathered to 10 people, does that mean limiting the number of people in a library to 10 people? And the answer isn't quite that black and white, and we'll get into that in just a minute, but certainly it means that we shouldn't be offering public programs that would encourage groups of people greater than 10 to gather in close proximity with one another. I think an important point to consider is your ability to clean your libraries and to sanitize your libraries. I know that many of you provide your own janitorial services. So do you have the time and resources necessary to clean and sanitize those facilities where staff and patrons are coming into contact on a very frequent basis, more frequently than daily for certain? If you're not responsible for that kind of janitorial service, is the company or person doing that work for you able to maintain the cleanliness of your buildings? We've talked about the need to quarantine materials, and several libraries have said they're using their conference rooms, for example, as a place to store materials while they're being quarantined. Do you have processes and procedures in places in your libraries that make that quarantine possible? There is some direction in the guidelines about having special hours for vulnerable populations. And again, that's something that we've seen in a lot of the grocery stores and other kinds of facilities in our communities. Do you have the option of being open for an hour or two at certain times of the day or week to just specific patrons who may be elderly or more at risk from COVID-19? Are you able to provide hand sanitizers for your staff and for the public that are coming in? Again, these are all the guidelines that the governor has set forward for businesses as they are considering reopening. So, as I said in my email, I would really only encourage you to think about reopening if you can respond in the affirmative to these kinds of questions. If you can't, then I think you should think about providing some kind of alternative forms of service, whether it's continuing with a curbside service or perhaps bringing in patrons by appointment only, perhaps doing closing your stacks and having some kind of paged stacks access. So it doesn't necessarily mean your buildings have to be physically closed, that the facilities themselves have to remain physically closed, but you should think about what it means to be open and what your services look like in a modified open fashion. I know that there's just a little bit more guidance specifically about the question of people in the library. And again, I said that the guidance to limit group sizes doesn't necessarily mean you must limit the number of people, both staff and patrons in your library, to 10 in the building. Some of you have very large libraries, and it would be relatively easy for more than 10 people to socially distance. Some of you have very, very small libraries, and that would be very different. And so that's something to think about when you consider the size of your libraries. I think what you really need to be thinking about is where groups might gather, and do those spaces encourage groups of more than 10 people to gather, and are our services encouraging groups of more than 10 people to gather, and putting limits on how people engage in our staff to prevent that from happening. So again, looking at other kinds of businesses as a model. Do we need to close off certain areas of our libraries to not encourage people to linger? Do we need to close off access to our stacks so that people aren't lingering or running into other people in close proximity within those stacks? Some of your libraries may allow for one-way traffic using different entrances and exits. So again, I don't think we need to necessarily consider limiting the number of people in our libraries to 10. That would certainly depend on the size of our libraries, but we should think about how we can use our space to discourage that kind of interaction with people. I'm gonna stop there and ask if there are more specific questions, and then encourage discussion about what your plans are.
Jenny, this is Susie. Do you have any guidance about how we talk to people that don't listen? I mean, I'm really concerned about like the shooting that happened and with Oklahoma or wherever, and my staff are very concerned as well.
Yeah. So if someone isn't listening, the word is totally going out of my head, but we all have policies in place for how to handle patrons who are not following policies and procedures, and that's really what you're describing. In many cases, they would lose privileges to access the library, and if they're in the library and they're not following the practices that you're putting in place, you have every right to follow those policies, including asking them to leave. I don't know if your libraries have security that you could call upon to ask someone to leave, but that's certainly the steps that we would take for someone not following the practices that we plan to put in place when we reopen the library. They would be asked to leave, or they wouldn't be admitted to the library if we had that option, and if they weren't following those procedures, we would engage with security.
Thanks.
There was also a question in the chat box from Kelly about creating a comparison list for reopening between a city county library, a public district, or a city library. I think there were worries about liability in regards to procedures to reopen. And there are some opening plans in the COVID-19 library reopening guide. Kelly, I'm not sure. I think there's a lot of generic plans, and it's kind of hard for some of the ones I found online. Some of the information was already scrubbed, so it's unclear if it's a district or a city county. It's just kind of a generic public library. But there are plans from specific libraries on there, a few of them. So hopefully that does help you with your task. And if anyone else has plans that they would like to share, please do let us know. And Beth passed on Kelly's question to an attorney who does pro bono work for Montana libraries, which is great. Beth had asked, there was a shooting, and yes, I believe in Michigan, actually, there was a security guard who was unfortunately shot and killed because he stopped a family from entering a Dollar Tree or a Family Dollar, and they weren't wearing masks. Yeah. Nancy had asked, is anyone limiting the use of bathrooms? Kathy said we are limiting to local folks. Starla and Hot Springs said we shut ours down. And then Nancy said, how do we share our policies? Cascade County approved our reopening plan. Nancy, you're welcome to send a copy to me. You can just send it to akim@mt.gov. I've put that in the chat box. And I can post that in the reopening guide. Thank you so much for sharing. Any other plans, concerns, things like that?
No, I don't want to get ahead of us. Are we planning to have a discussion about masks, hiring patrons to wear masks?
Yeah, I figured we could put that in here as well. There's not a specific slide to it, but we can go into that if you'd like to now. And there was, oh, sorry, go on.
Go ahead. No, go ahead.
Oh, real quick, Cindy said, I think we have to have some some bathroom facilities available for emergencies. Maybe a bathroom that can be opened for patrons as needed. That's a really good point, Cindy. If anyone has any thoughts about that, please contribute. But there was a question that had come in through the webinar evaluation of these COVID sessions, and someone had expressed interest in having a bigger discussion about masks. And I don't think this is a question just in the library world. I think the world is kind of trying to decide whether masks should be required, and how to best go about enforcing that, and how to have that conversation. And so while I don't know if there's a way for us to reach consensus as a group in terms of where we should all stand on mask wearing policies and also enforcing mask wearing policies, it might be good to compare and see what people are thinking about doing. Is anybody planning on putting an explicit mask wearing policy for access to the library? Has anyone had that conversation already with any patrons? Anything like that? Let's see, Mitch said, tough to encourage hand washing if you close down the restrooms. Heather said, our restrooms are open, but we were able to monitor them because we're in a small library. We are making everyone wash their hands when they first enter the building. Connie says, we are strongly encouraging, but sidestepping the requirement. I'm assuming that's for mask wearing. Connie, feel free to clarify if that was incorrect. Val said, we are also making people wash their hands upon entering. Connie said, we want to avoid altercations. There is a growing anti-science movement here. Yes, because she was talking about the masks. And yeah, I mean, just even thinking, I think it is well and good to have a policy. I mean, that's probably better than nothing, but I mean, in these fraught times, you know, I think it's also really important to watch out for your own safety. And, you know, I would really, really hope that no one ever has to encounter a situation like what happened at the Family Dollar in Michigan. But you know, I hope that no one sacrifices safety for the sake of a policy, even though the policy is probably better for the general public health of all. But yes. Connie also mentioned thinking that we can use wayfinding and distancing to make people move through the space quickly. Heather said, I'm not sure you can require masks when it's not required in the directive. Susie says, we are requiring staff to wear masks. We are encouraging, but not requiring masks. We bought standalone hand sanitizing dispensers that will be available throughout the library, including right at the entrance. We are going to encourage patrons to use the hand sanitizer.
I want to jump in and say I did speak to the governor's office about whether or not libraries could require patrons to wear masks, even though it wasn't in the directive. And they agreed that it was something that could be left up to a local library board. And again, your libraries all have disruptive patron policies. You have policies for what is appropriate behavior in your libraries. And so your boards would have the authority to create a policy requiring your patrons to wear masks. If that was a requirement you were thinking about, I would certainly suggest that you have your board pass a policy so you have that backup from your board to rely on. I know some of the libraries that I've spoken to that are enacting a mask policy are saying that where a patron isn't wearing a mask, they're asking the patron to stay outside the building, and that the staff would bring them the book or other resource that they're there to receive, but not allowing a patron.
Connie had shared an article from CNN. A Dollar Tree worker had told a man he needed to wear a mask, so he wiped his face on her shirt. And then Val said, our staff is wearing masks and we have disposable masks available for patrons who do not have one. Pam said, it's also important to communicate any policy updates to the public if masks are required, for example. Laura asked, is anyone planning to provide masks for those who come without them? Oh, okay, yes. And then she saw Val's comment. Mitch said, there might be a question of liability if you are providing masks. And Mark said, our city attorney, Mark from Bitterroot, our city attorney advised us against providing masks. Starla said, we are requiring that staff wear masks. We are taking the tack that people need to look out for their own health. We are offering hand sanitizer at the door. We have no cases in our county, which makes our population somewhat cavalier and bordering on abusive towards staff. As far as the bathrooms go, we don't have the cleaning staff to clean the bathrooms after every use. Of course, we are set for emergencies.
Jenny, this is Joe. Should librarians be keeping track of any feedback they're getting from patrons? So we want to collect that in any way. Is that going to be useful?
Useful for us? Give that some thought, Joe.
Okay.
Yeah. Susie wants to know if they should clean the whole bathroom after every use. So I think it depends a little bit on the size of your library and where the patrons are going. But if it's a small to medium sized bathroom where they could potentially come in contact with a significant amount of the space, then I would say yes.
So I spoke with, this is Wadsworth Library, I spoke with the COVID hotline for businesses yesterday and asked specifically about libraries. And they said, follow your local guidelines. But the information that I understood was basically just clean the main areas where they probably would be touching, like the door handles, the faucets, the lever on the toilet. If you have handrails, wipe those off. If you have like a baby changing station, if you think that they probably used it, wipe it down. But they didn't seem to think that we would have to clean the whole bathroom. But admittedly, we've all gotten different information depending on who you call and when you call. But that's the information we got. I'll be honest, I've had a problem because we share the bathrooms with the town hall, and we are having a vast difference of opinion as to the use of the bathrooms. And that's one of the reasons I called the COVID hotline for businesses. They seem to think that we should be allowing bathroom uses because we are a public entity, open to the public, and we should be offering bathrooms. And how can we wash our hands for use of the computers unless we allow the bathrooms to be open? So that's why their suggestion was just to, and I admit I am a small library, but I'm just a one person, but I have been going in and cleaning after each use. There's still a very volcanic attitude between me and town hall as to how this is going to work out. But all I'm saying is I'm following the city county guidelines and the guidelines from the state.
That's really great, Nancy, and that you're able to point to those things, and for sharing that information with all of us too. Thanks. Jody had said, honestly, these are all valid reasons why we might be better off staying close to the public. Behavior is hard to manage, and if we are constantly having to say no, the possibility of patrons acting out is higher. And with so much closed and kids can't coming in without parents, et cetera, you know, it might be better to stay closed. And then Connie said, that's a great point. I think most people will do the right thing and be gracious and appreciative. I don't think the behavioral issues will take up a lot of space. And I do hope that is the case. Starla mentioned our bathrooms are wide open, so one sneeze and we're looking at cleaning the whole thing. Washing hands is only effective if they are washing their hands for 30 seconds and we can't monitor that. We have been open since the 27th. Heather says this and have not had any patron issues with our new procedures. Mitch asked if the bathrooms were wide open. And Mark asked, we have only been open since May 4th, but things have gone things have gone well so far with no behavioral issues. Most are grateful and only some minor grumbling. And Beth, for your question, Heather is in Forsyth at the Rosebud County Library. Mark said open for the Bitterroot Public Library means no more than 4 patrons at a time, 30-minute limit, and a mask is required. And Starla said it's not open out back, Mitch. So thank you for that clarification.
Yeah. I think that example is really a really important way to think about what it means to be open. You know, there are grades of openness, and we can accommodate different kinds of service models if we choose to open our facilities.
Is anyone planning on talking with their board about instituting a mask required policy, or has already done that? I guess, Mark, your library has already done that, but is anyone else thinking about doing that?
No, the Choteau County Library has a mask policy in place.
Okay.
Sandra told us that yesterday.
Okay, that's the one in Fort Benton.
Yep.
Cool. Christine said, I will ask about it, but they do not seem as concerned about masks as they are about social distancing. And it might still be worth bringing it up, Christine, so I think that's a good plan. There's a small library with few resources, yes. Any other thoughts as well? Cindy said it's really important that staff follow all these guidelines as well. We have to be role models for our patrons, which is a great point. And then I did also want to share in the chat box this link. I think it's from a catering company, but they talk about Banquet Tables Pro social distancing room space calculator. So you can kind of put in your square footage of your available rooms and your available space and see with like 6 foot, 7 foot, and 8 foot distancing how many people you can have in a room. Also, I'm pretty sure those are the words to the banana song that I just said. And then Kathy, I'm not sure what library you're from. Is that maybe from Valier? We agreed to recommend that they wear masks. Jody said, for those with stacks open, are you cleaning every surface patrons touch, every book they pull off the shelf and put back? Kara asked, do all of you have reliable supply and budget for masks, gloves, cleaning supplies, etc.? And actually, yes, there is. Let me actually just go ahead and share this now. So Humanities Montana has just announced, it's a rolling grant. I'm putting this link into the chat box now. It's the CARES grant, relief funds for cultural institutions. And it's a rolling application, and libraries are included in cultural institutions to help with the effects of COVID-19. So you can start applying for that. I'm not sure how often they meet to determine who is awarded. They do have a preference for friends groups of the libraries and foundations to apply, but they will accept applications from libraries directly if you do not have a friends group. And I did ask Kim Anderson and the grant committee if using funds to purchase cleaning supplies would be a valid use of the grant money. And they said, yes, that would be an acceptable use of funds.
Lots of discussion in the chat box, just that even if you have the money, where it is a little difficult to find a source to acquire these materials.
Yes.
This is going to be hot off the
touch. Yeah, go ahead, Jenny.
hot off the press. This announcement is not yet public, but is likely to come out tomorrow. Additional guidance for gyms, movie theaters, and museums. And the guidance will be similar to what's already in place for restaurants, including maintaining a reduction of your normal building capacity to 50% of your normal building capacity. So something to keep in mind when you're thinking about the number of people in your library. That's the guidance that's currently available for restaurants and bars and breweries. It sounds like the governor's extending that to gyms, movie theaters, and museums, as well as maintaining social distancing and increased cleaning requirements. So it sounds like it's pretty similar to what we're discussing, but I think we should keep in mind that 50% of normal capacity when you're talking about the number of people in the library.
One other thing we haven't talked about yet is what to do if you have a known exposure in your library. Somebody comes in who turns out to be sick or to test positive, and you may need to think about what you're going to do when or if that happens.
And how to communicate that to people too as well.
Obviously first your staff, and but then also people who've been in the library, they will need to know. Mm-hmm. There are some resources. I passed some things on to you recently, Amelia, that from the CDC for businesses operating community spaces on how to approach that.
Is that in your email? I think that finally came through.
Yes.
That you sent me. Okay, I will try and look.
It was in my drafts folder. I thought I'd sent it earlier, but I didn't.
Okay, cool. There was a few other comments. Beth, yes, the Humanities Montana grant they do want a nonprofit 501c3 to apply, but I did talk with Kim. They will accept applications from libraries directly if you don't have a Friends or a foundation. Susie said our City County Emergency Operations Center is helping all city departments get necessary supplies. You could reach out to them. Starla said we shortened our hours to 4 per day. 4 hours is a long time to wear a mask, and we won't even talk about wrapping books with gloves on. This is very challenging and makes you feel like a target behind the counter, and the Barry has been very helpful. Heather says, I don't think it's possible to clean every surface they touch. We do the best we can, but we're in a county that has had no cases and are in a small library with very few people coming through. Connie asked, does that mean that those can open before phase 2? And I'm not sure what exactly.
This is Connie. I was thinking about the new guidelines that'll come out for gyms and movie theaters, and I thought they weren't open until phase 2. Does that mean the entire state is moving into phase 2?
I don't believe so, Connie. I just think that it sounds to me like what is being discussed is including those other kinds of businesses in phase 1.
Got it.
And I think that also addresses Kelly's question about if we're moving into phase 2 soon.
It doesn't sound like it, but more information from the governor's office tomorrow
Jody asked, I wondered if we needed to implement a sign-in for patrons so that we could track people down in the event of an exposure. Can we even do that? Susie said we were planning on being open for an hour for vulnerable populations and then closing for an hour to clean, then opening for 2 hours for general public and closing for 2 hours to clean, and then open for another 2 hours to the general public. We have clarified with our union that cleaning duties count as other duties as assigned. And then Kathy asked, can we put up a sign stating this is a public building, please be aware of others? That sounds fine to me. I think
I do
that's
have
a
a
good
question.
reminder.
When we were talking about, notifying some, like people have been in our libraries, if we came up with a positive case, I would assume the only way we could do that is just like putting a public notice out, because we aren't allowed to keep track of who comes in our library. So how would we know who was in there that day or what? Any ideas?
Well, I was also I was talking with a friend who is currently living in South Korea, and she said that anyone who is a confirmed case has to, I mean, I don't think this would work here in the States, but they had to delineate all of their physical activity in the past 2 weeks. And then they would post that through like the National Tech Service and tell people there was a known person with COVID in these locations on these dates. If you have been in these areas, you need to go get tested. So I don't even think health departments are able to do that.
Well, I can tell you a little bit because of my experience as an EMT and what I was trained for in HIPAA. Like I can't tell anybody that Amelia Kim has anything, but I can, public health officials can say that a exposure occurred on a certain place on a certain day, and that's different than exposing a person's personal information. So they actually do that. They will ask a patient where they've been, and then they'll notify places. It's possible libraries will get a notification that a positive case was in their library on a certain day. And then it would be up to the library, and it would probably be to advise their staff who was there that day, because they'll have a record of that. And that's why I brought up the question. I think it's worth thinking about now before it happens, so you're not scrambling to figure it out.
Figuring out who would you contact, how would you contact them, how would you communicate to the public.
And I agree with Nancy, and a notice to the public in the newspaper and signs on the library that there was a known exposure on this day. It seems very reasonable in the interest of public health. You don't have to tell it. You won't know who it was if the health department contacts you. And if it's a member of your staff and you don't need to reveal that.
And Connie, I did see your comment about virtual board meetings. You're more than welcome to ask it here, but you're also welcome to email one of us if you prefer to do that too. Mitch also asked, is any other public or private entity required to keep track of who's been in the building? Connie said your health department may be able to help with contact tracing. If we get sick at the library, we will work with her. Heather included a link to track active cases across the state in case anyone needs it. And then Kara asked, what is the plan if a staff person presents with COVID symptoms but is unable to be tested? Will you assume that there may have been exposure?
I would, Kara.
Yeah, it might be better to be safe rather than sorry. And then Connie,
I think we would
sorry.
quarantine everyone at that point.
Thanks, Jenny. Connie asked, should we ask for a roll call vote during virtual board meetings?
I would only call for a roll call vote if there was, if it wasn't unanimous. If it was going to be a unanimous vote, I don't think that's necessary. But if it isn't going to be unanimous, then I would call for a roll call. Or if you're not sure.
Awesome, thanks, Jenny. And Starla said, we've actually had that happen here amongst the county workers where someone presented with symptoms but wasn't it wasn't confirmed, and the county assumed that there was exposure and quarantined his entire family. So thanks for sharing that, Starla.
So if there was we get notice that there had been a positive that had visited the library, do we then quarantine the library for 2 weeks? Is that how it works?
I would assume you would get more information from health officials, but if there's concern that you or some of your staff were exposed, I think your staff would probably want to be quarantined if they're not able to get properly tested. And then it would be a matter of whether or not you could staff your library or not, thinking about keeping it closed. And as we've been talking about, making sure that your building is cleaned and sanitized.
And then I think Beth, in response to how South Korea was handling things, using cell phone technology to track people if one person was infected, and then locating who is around you. So yes, not a text you want to get. Oh, that's in the USA. Oh, okay. And then Suzanne said, I think cell phone tracking technology is under development here, but not yet put into place. Any other comments? I do want to remind people, and I'm going to put this into the chat box. There are discussion threads on the MSL community forum, and a lot of the stuff that was shared in here I think would be really great to go in those forums for other people to see, and also to kind of keep an archive of the kinds of decisions we're all having to make and think about. So I just put that link into the chat box. If any of you are willing to share any of the information that you've just shared into those posts, that would be really, really great. And I think could help inform others as they're making decisions as well. Jody says, in Red Lodge, we have a lot of seasonal residents and lots of visitors. Can we limit access to locals, full-time locals? We are a small community, so I know that some of them will come from another state. Do we take them at their word that they followed the 2-week quarantine?
That's a really good question.
Yeah, that's a really good question.
I was just going to jokingly say you need a tribal to live on a reservation where the tribe actually takes care of those things for you, but you can't do that, Jody, so it's not very helpful. I don't know the answer to that. What would your advice be, Jenny?
Well, I kind of feel like you have to take them at their word. Mm-hmm. To my knowledge, I haven't seen or heard anything about how the state is enforcing the governor's 2-week quarantine for people coming in from out of state. But that's something we can follow up on to find out if there are any steps that the state is taking to try to enforce the quarantine and pass that information along.
Well, I can share
steps.
I can share a story with a friend who came back to Montana. She lives here from Alaska. And when she departed from the plane in Kalispell, she was met with, there were National Guards guys there who asked her what she was planning and doing. And she said she was coming back home. And they gave her some information and told her she was expected to quarantine for 14 days. And when she got home, the local police came and visited her to remind her yet again that she was, so they forwarded her information. They told her they were going to do this. We will forward this information to the local law enforcement. And they actually followed up. So she felt pretty much like she was very clearly directed. So I don't know if that's happening with everyone, but that's just sort of one story.
Yeah, I think I can see how that would be easier to enforce with someone who is coming in on the plane versus someone who might be driving in from out of state after having been a snowbird in Arizona, for example.
Yeah.
I'll see if I can find out any more information about how quarantines might be being enforced.
Let's see. Susie said, I think we need to remember that we have I can't read. We are paid for by tax dollars, and that citizens have a civil right to access public services. Any restrictions that we place on patrons have to be evenly applied. And Heather said, our public health department is greeting people who have come back from out of state. Okay. Any other comments and questions? I know that we are reaching the top of the hour. So if you do have to step out, feel free to. There is a few more slides to go over. So I might just continue. But then this next piece of information about the economic development part will also be covered on Friday at the website chat at noon. So if you're not able to stay for it this time, I will be repeating myself on Friday. So you can catch it then if you like. And please, if you do have any other thoughts, ideas, plans, please feel free to share them here, or you can also share them in the MSL community forum. So I did want to make sure we had some time for the MSC staff to discuss reopening and closing assistance in the system. So MSC peeps.
So this is Amy Martwick, Montana Shared Catalog Administrator, and this is our system administrator. This is mostly just a reminder of the stuff that we mentioned last week. If you're not in the shared catalog, we recommend you discuss with your vendor or your system administrator what options you have for batch changes and reopening and changing due dates and things like that. For Montana Shared Catalog libraries, in the MSL help desk, there is, in the Montana Shared Catalog section, there is an emergency closure and reopening services articles where we have several questions that we need information from you as we configure you to reopen. And we ask that you open a help desk ticket with us. And then just a highlight of, as we've made online registration available for all Montana Shared Catalog libraries, in Blue Cloud Analytics, there's a pre-built report where you can get stats about any of those that may have happened for your library.
Awesome. Thanks so much, Amy. And I did drop in that help desk knowledge article into the chat box. So feel free to click on that and use that if you need to. There was one more comment from Starla. The motorhomes have been coming in from Idaho and Washington. Yes, and people are saying that they came here to escape the virus. I don't see any way I can get away with discriminating against them without requiring locals to report where they have been. We are simply at risk. And yeah, I think, based off of the stories other people have shared, it does seem to work best when it's coming from the health department and local law enforcement. So for better or for worse, I don't think that's the place of the libraries to enforce that. But it is a shame that people aren't very careful.
It sounds like a lot of our library directors have gotten to know their health department really as a result of this, and that's a good thing. They are an ally, hopefully, in this issue.
And maybe that's something to even just tell the health department and be like, we're not able to really do anything, but just so you know, these are people who are crossing state boundaries, and I don't know if you guys have a plan about them. You just might be able to let them know what is going on. And so really quickly, I did want to go over some economic development opportunities. We've been working with our economic development consultant, Ann Booth, and she's been having some really good conversations with various organizations across the state. And we came up with the following 4 ideas and projects that we would really love to see if any library would be interested in working on. These are all things that are still under development, so it definitely would be a process of mutual creation if you would like to volunteer to be a part of this and to try it out in your library. But I wanted to give a brief overview, let you know what we have brainstormed and identified as the main tasks for these 4 projects, and then see who might be interested in trying these out. So the first idea was having a business resource center in the library. So having an up-to-date and dedicated space for small businesses and economic development resources in the library. The main tasks associated with this would be finding the space, finding partners to help provide information in your center, keeping the center updated, and helping patrons to connect further with any of the organizations or information that you're providing. Things that Anne and I and the economic development community are hoping to provide are SBA is the Small Business Association, working with them to provide some of their resources, which are really great and quite extensive. SBDC, which is the Small Business Development Center, providing some of their brochures, their information, and then also having posters and branding so that people recognize this as a service that libraries are providing to the economic development community. I told Anne, I was like, I would not be surprised if some libraries already have something like this, whether formally or informally. So please do let me know if this is 1, something you want to do, or 2, something you are already doing. And let me know. Jody said, I'm not trying to knock the Business Resource Center idea, but if we have a chamber in our community, wouldn't they be providing this information to local businesses, and shouldn't we be supporting their work and not competing with it? And yeah, that's definitely a great idea. I think it's sort of similar to how a lot of libraries have like a health center. And, you know, there's obviously the local health department. There are various other organizations that provide that information as well, but kind of consolidating everything into one place could be helpful, and also could just be another entry point for somebody to interact with this information. And some people just might come to the library more often and never occurs to them to go to the Chamber of Commerce. So just another way to kind of shunt people into the correct channels. And ooh, Carmen dropped in a link for Adult Business Center stuff. So thank you, I'm going to look at that. Thanks, Carmen. Another idea is facilitating business webinars for the public. So this one is to try and specifically target non-computer literate small business owners, and not even non-computer literate, but people who just don't have internet at home. So helping those people connect with the Small Business Association and other organizations to attend webinars on the CARES Act and COVID-19 aid programs. The Small Business Association was saying they've worked really, really well with local banks and have connected with a lot of people, but the audience that they have not been able to reach are those people who don't have internet and who don't have the skills to access those materials through the internet. So this one's a little bit more time sensitive because the SBA is hoping to start this sooner rather than later. Tasks would include opening up your meeting room and creating a webinar viewing space for individuals and small groups. But you know, making sure you can still have social distancing precautions and processes in place. Coordinating with the SBA outreach staff, providing and managing the technology and equipment to allow viewers to ask questions and interact with the webinar, and then publicizing the opportunity to the public. So things that we're hoping to provide are connections to the local organization outreach staff and a general scheduling structure. This one, I think we would need people to actively work with us to help create something that would work. And, you know, especially with all of the questions that we're all considering around reopening guidelines, maybe this isn't the right time to think about this. But if you are interested in doing this, if your library does have the space, if your library might be able to accommodate this, please do let me know sooner rather than later, because this is something that the SBA is hoping to move on sooner rather than later. Another program idea is the Small Business Development Center Advisor Program. So helping SBDC advisors throughout Montana connect with small business owners to help with CARES Act and COVID-19 decisions. The main tasks for this would be providing a confidential space and or computer for a patron and a consultant to meet virtually, review documents and discuss openly together, and creating a system that allows this space to be scheduled out for each appointment. The SBDC people, I think, have been moved virtually for their consultations, and a lot of people are having trouble finding that private space and finding the equipment to actually have these meetings. So that's something that the SBDC was interested in working on. This is also a time-sensitive project, so please email me sooner rather than later if you would like to work on this. Another idea is mobile printing. This is actually something that we mentioned in an earlier webinar, and I think I remember some people saying that they were already providing this, but helping provide at least some services to businesses for those people who maybe don't have a computer, maybe don't have a printer. The main tasks for this would be using Printer-On or whatever equivalent software to organize a mobile printing service. There have been a few conversations about this in national webinars, and I'm more than happy to point people towards those if they'd like more resources on that. Yeah, for this one, I don't think this requires a whole lot of coordination. It's mostly just trying it out, letting us know what support you might need, and seeing what works best for your community. So let me know if you're interested in working on that. And then something sort of long-term is providing digital literacy, technical assistance, and training for small business owners. I think virtual services and working virtually will continue to be the norm for a while. And, you know, there's a lot of people who I don't think have had to learn these skills and now are really realizing that they do need to learn how to do these things. So this is very TBD at the moment, but some main tasks we thought about were providing training with web conferencing apps, meetings online, making use of online productivity, scheduling, and communication channels, and sort of just exploring what does it mean to move things onto a virtual business and doing things virtually. So like I said, this one is a little bit more long-term and is probably the least formed at the moment, but please do let me know if you are interested in working on this as well. And I'd be happy to discuss with you further. Any questions about any of those things? Again, I will be discussing this all on Friday again, and we'll be updating you throughout with more ideas and progress as we go forth. But right now we are looking for libraries who are interested in doing this work and would like to help us determine the direction of these programs. So please do reach out. A few more announcements. We have some new COVID-19 resources. All of these things are listed in the COVID guides, but the Humanities Montana CARES Act grants, I put the link for that in the chat box. That's a rolling application, and they do prefer friends and foundations to apply for this grant, but libraries who don't have those organizations are also welcome to directly apply as well. The social distancing space capacity calculator I also put into the chat earlier, so you can play around with that. The Boston Public Library had a great article in the Library Journal publication about serving the homeless during COVID-19. So you can read that for some really great ideas, and also how they partnered with local businesses in order to do this as well. The California Public Libraries have been submitting virtual programming ideas to a database, which is now available to the, I think it seems like it's open to the public to just look at. I'm going to put that resource and link into the chat box, so you can take a look and see if there are any great ideas on there that you want to try and emulate, and see what resources they're sharing there. I also wanted to share, I think Suzanne, you had sent this out on Wired earlier, the Grow with Google Libraries Lead with Digital Skills grant program. So I put that link into the chat box for you all to take a look at. The COVID discussion threads, those are the, that link I also dropped into the chat box earlier, and I just put that in there again. So please, please, please do put in any information you'd love to share about your library and how you guys have been brainstorming, cleaning procedures, new policies, et cetera, et cetera. Anything that you're willing to contribute would be great to share with your peers. And then also the Read Squared interest survey. It's kind of hard to see that. So let me, interest survey. If your library is interested in using Read Squared, which is an online reading tracking software for summer reading, or even just for any other kind of program that you do, please do fill this survey out and let us know. The State Library Commission recently approved a purchase of Read Squared for 2 years for up to 40 libraries. So we're looking to see who is interested, and please do fill out this survey if your library would like to try this out. And then please also fill out this evaluation with any suggestions and feedback that you have for these COVID meetups. This really is a time for you all, and we want to make this as constructive and as helpful as possible for libraries. So please do let us know if there's anything that we can provide better support on, et cetera, et cetera. I'm going to drop that into the chat box. And please fill out this evaluation. And then, Joe, I think, did you include this slide, or was this elsewhere? I think we did want to know how people were using this information map.
Yeah, I just threw it up, but we're out of time today, but I am curious. And just as a reminder that if you are changing your status at your library, to be sure to update your information.
Awesome. Yeah.
Contact us if you need to know how to do that.
Yes. And Jody said a suggestion for next week, hearing more from libraries who have opened to the public, especially ones that represent different sizes. I appreciate what Heather, Mark, and Starla have shared today. I'm probably forgetting someone, sorry. And I appreciate hearing more from them about how it's going, what they've learned, what kind of traffic and demand are they seeing. And also hearing from other libraries about their plans for when they open, specific sanitizers to buy, disinfectants, etc. Pictures of plexiglass setups at circulation desks, examples of signage inside and outside the library, etc. So yes, we can definitely continue these kinds of conversations next week, and maybe I can reach out to some people and see if they'd be willing to, you know, just have a panel time with people who have reopened and see what they have to say. But everyone else, please do share in the MSL community forum, even just like questions that you have, and other people can answer, and that would be really great.
Great suggestion.
Yeah. Thank you all so much for coming today. I'm sorry that we ran over again. We will be having another meetup next week, Wednesday, on a date that today is the 6th, so the 13th, at 3 p.m. So please do join us then, and have a great rest of your day. Thank you so much.